much for being here. My name is Mary Tornaveni. I am the program manager for shelter-based service teams. And today we have some Heartland Alliance staff with us and a guest, Joshua Dushop from the Chicago Department of Public Health. Our staff here today are Jade Greer, who is the manager of outreach and testing for Heartland Alliance Health, Sam Long, a community health nurse for Heartland Alliance Health and Rush, Greg Bowman, who is also with Heartland and Rush, and Melissa Kalinsky, who is a nurse practitioner with Heartland Alliance and Project, but is also with us from Rush. Today we want to listen to your questions. We really want to work and engage you and your staff and your participants in the vaccination process. We want to inform you about the vaccines, tell you what our future planning goals are, talk a little bit about rollouts. We don't have dates yet, but we'll let you know. And at this time, I'm going to turn it over to Sam. She's going to go ahead and start.
Hi, everybody. Can you hear me okay?
Yes.
We can, thanks.
Awesome, thank you. Hi, everyone. So for those of you who don't know me, my name is Sam. I'm a nurse with Heartland Alliance Health on the shelter-based service team. We want to thank you for allowing us the opportunity and for giving us your time to discuss the COVID vaccine with you, COVID vaccine information with you, I should say. We are here to provide accurate information about the COVID-19 vaccine, answer questions, and address any concerns that you may have. This presentation is also an effort to have an open conversation and provide all the knowledge that we have to help you make an informed choice. The decision to vaccinate is yours and yours alone. We want to share the information that's available and support you in any way that we can. At the end of this presentation, we'll go over all the anonymous questions that have been submitted and also open it up to any other questions or concerns you may have. Again, thank you. All right, next slide. So what is COVID-19? As many of you know, COVID-19 is a highly infectious virus that infects the nose, throat, and lungs that can be easily passed from person to person. It originated just over a year ago in China when it passed from a wild animal to a human and rapidly spread across the world. This has obviously impacted all of our lives this past year. Next slide. You may have seen movies or TV shows that talk about viral outbreaks or may have even mentioned the word coronavirus. These are referring to either fictional, meaning made up viruses, or prior coronavirus outbreaks that are documented and that we know of. You remember SARS virus, that's back in 2002. SARS is actually a type of coronavirus. The COVID-19 virus, however, is a new type of coronavirus that we have not seen before. Also, as a fun fact, these viruses are called coronaviruses because they're named after the crown-like spikes, which are those proteins on the surface. Basically, in Latin and in Spanish, corona means crown, so they're named this way because of the way that they look. Next slide. So this Swiss cheese model of pandemic defense is an illustration of all the things we currently do to prevent the spread of COVID-19. One single action, like washing your hands, would not be enough to fully protect you since there are a lot of holes. However, when you add additional layers, such as wearing a mask, social distancing, and wiping down surfaces, that's when we're the best protected. While we have been doing all those things listed to the best of our ability, we now have another huge layer of protection to add that's available to prevent the COVID-19 infection, which is the COVID-19 vaccine. Next slide. So flu versus COVID vaccine. So while both the flu vaccine and the COVID-19 vaccine both work to prevent infection, the way in which they work are a little different. So let's talk about some of those differences to help you better understand what's going on in your body after you're given the vaccine. Next slide. So how does the flu vaccine work? So when you're given the flu vaccine, the vaccine contains a piece, just a piece of the dead flu virus. Your body knows that this piece of virus doesn't belong there, and your immune system, which is your body's defenders, destroys it. The vaccine may make you feel mildly sick for a few days. This is actually a good sign. It shows that your body is working just like it should. During this entire process, your body learns and remembers how to fight off this virus in the future. Also to note, the flu vaccine does not and cannot actually give you the flu. Next slide. So how does the COVID-19 vaccine work? So you may have heard the term mRNA. So mRNA stands for messenger ribonucleic acid. Think of RNA as a blueprint on how to make something, like building a house. Scientists took the blueprint for the COVID-19 protein, which are those spikes on the outside and around the virus that you see pictured, and made an mRNA version of it. Also, in no part of this process does this vaccine alter your DNA at any level. It's medically and physically impossible. It does not have the ability to get into your cell's nucleus, which is where our DNA is. So no part of your DNA is changed or altered. Next slide. The vaccine contains no actual part of the coronavirus. It only has the instruction manual or the blueprint on how to make the COVID-19 protein spikes. So your cells see these blueprints and they say, sure, I can make this. So your cells make a bunch of these COVID-19 proteins. Remember, not the virus itself, just the protein, just a part of it. You cannot get infected with COVID from the vaccine. Next slide. So once our body starts making these COVID-19 proteins, which can take a little time, our immune systems, our fighters and defenders, immediately sees these proteins in your body and really doesn't know what this is and knows that it doesn't belong there. So it starts attacking these proteins. If you've never been infected with COVID, your body has never seen this protein before. However, our bodies know that they don't belong there, and the fighters launch an attack against the protein. The possible side effects that you might experience, like chills, muscle soreness, fatigue, etc., which are similar to side effects from the flu vaccine, means your body is doing exactly what it should do. It's fighting and getting rid of these proteins. Next slide. At this point, your immune system has done exactly what it should do and has attacked and destroyed the COVID-19 protein. Now, here's the important part. Your body will remember this protein and what it looks like, and it will remember exactly how to destroy it if you're ever exposed to the COVID virus. By the way, remember that blueprint your body was given to build the COVID-19 protein? Your body will break this down and erase these instructions pretty quickly. That's normal. So your body doesn't need those instructions hanging around forever, so your body gets rid of them. Next slide. So far, again, your body is doing exactly what it should do. It's gotten the instructions on how to build the protein. Your body has made the protein. It's gotten rid of the instructions on how to make it, and your body has destroyed the protein. At this point, everything from the vaccine is gone, except your body will remember that protein really well. Next slide. So now that you're vaccinated, what happens if you're exposed to the COVID-19 virus? So let's say the COVID virus enters your body. Your body has never seen this virus before, but it sees that protein, those spikes on the outside of the virus. Your body remembers these proteins and essentially says, this thing again, this has got to go, get out of here. Your body's immune system, which are the fighters, quickly and efficiently launches an all-out war. Your body remembers exactly how to destroy the protein, which was delivered to you in the vaccine. It destroys the virus before it can take hold, make more of itself or replicate, and make you sick. Next slide. So the wonderful news is now that you are protected against the COVID-19 virus, your body has the tools it needs to recognize the COVID-19 protein, destroy it, and get rid of it. Next slide. So vaccines do work. Because of vaccines, the annual number of cases from these infections and conditions that are listed have decreased significantly or have been wiped out entirely, almost wiped out entirely. Keep in mind, while disease rates are lower across the board, most diseases have not completely disappeared. This is why we continue to vaccinate. Next slide. So type of COVID-19 vaccines available. So there are two current vaccines that are available, one by Pfizer, one by Moderna. Both of them are mRNA vaccines. Both of these vaccines were approved for use in December 2020. Next slide. This just kind of lists out the ingredients of both Pfizer and Moderna. So both the Pfizer and Moderna vaccines contain mRNA, lipids, which are fats, salts, sucrose, which is sugar, and buffers. So buffers help balance the pH of the vaccine, essentially to make sure it's not too acidic or not too basic, but just right for our bodies. To point out a couple that may look unfamiliar, but are actually quite common, are acetic acid, which is found in the Moderna vaccine. That's similar to vinegar, and sodium chloride, which is actually at regular table salt. The vaccines do not include fetal cells, blood products, COVID-19 virus cells, mercury, egg, pork products, preservatives, or microchips. Next slide. Who can get the vaccine? So if you are 16 and older, you can get the Pfizer vaccine. If you're 18 and older, you can get the Moderna vaccine. For people who are currently pregnant or breastfeeding, the vaccine should be offered and can be given. The American College of Obstetrics and Gynecologists say that while a conversation with a clinician may be helpful, it should not be required prior to vaccination. Remember, the mRNA vaccines cannot cause any genetic, which are DNA, changes. Next slide. For people with underlying chronic health conditions or for people who have weakened immune systems, the vaccine can be administered if there are no contraindications, such as allergies to any of the vaccine ingredients. What if you've already had COVID? Well, you can still get the vaccine. Natural immunity varies from person to person and may not last long, so those people would be eligible and should be encouraged to receive the COVID vaccine as well. Next slide. One of the important things to remember is that both the Pfizer and Moderna vaccines are 95% effective in preventing symptomatic coronavirus disease. The vaccine will also reduce the severity of symptoms if or when the COVID infection does occur. The vaccines were effective for all different races, genders, and ethnicities, as well as for people with underlying medical conditions. There is a slight dip in efficacy with the Moderna vaccine if you're 65 and over, but 86.4% is still great coverage. The Moderna trial data suggests that there's a decreased risk of asymptomatic transmission, asymptomatic meaning no symptoms. While Pfizer has not collected specific data on this, their vaccine is structurally very similar to Moderna. The overall goal here is to vaccinate 70% of the population to achieve herd immunity. So herd immunity occurs when enough people become immune or protected from a disease to make it spread unlikely. As a result, the entire community is protected, even those who are not themselves immune. Next slide. So how do I know the COVID vaccine is safe? So the US vaccine safety system ensures that all vaccines are as safe as possible. The COVID-19 vaccines available have gone through a very strict step-by-step process to ensure the vaccine is safe. Both the Moderna and Pfizer vaccines have gone through all 3 human trial phases. This research is based on people who volunteered to receive the vaccine and be a part of this trial. When you combine the number of people who volunteered to receive either the Pfizer or Moderna vaccine, that's more than 70,000 participants. After receiving the vaccine, the volunteers are also monitored to check for side effects, safety, both short-term and long-term, and the effectiveness of the vaccine. Next slide. Both Pfizer and Moderna vaccines have included volunteers identifying with a wide range of races and ethnicities, including Black, Asian, Hispanic, and Native American. Moderna has also included a small group who identify as an other category. Both vaccine trials also included volunteers of all ages, anywhere from 18 years old to more than 65 years old. Next slide. What about allergic reactions? So questions about those with allergies are valid concerns. If you have a known severe allergy, which includes shortness of breath, trouble breathing, facial swelling, etc., to any of the ingredients in the COVID-19 vaccine, it's not recommended that you receive the vaccine. If you have a severe reaction after receiving the first dose of the vaccine, then a second dose of the vaccine is not recommended. If you have ever had a severe reaction to any other types of vaccines or injectable therapies, a conversation with your provider first is recommended. If you have ever had a severe reaction to non-injectable medications, including oral medications, the medications we take by mouth, food, animals, environmental allergens, if you have a family history of severe allergic reactions, or if you've had a more mild allergy to a vaccine, you can get the COVID-19 vaccine. Next slide. So how is the COVID vaccine given? So just like the flu vaccine, it's given into the muscle. Most commonly, it's given in your deltoid, which is the big muscle on the outside of your arm, just below your shoulder, like the picture shown. The vaccine will be kept in cool storage until it's ready to be delivered and given at shelter sites. The Pfizer vaccine is given 21 days, which is about 3 weeks apart, and the Moderna vaccine is given 28 days, which is 4 weeks apart. Keep in mind, you need both doses to be fully protected. Next slide. Will there be side effects? Remember, experiencing some minor side effects from a vaccine is totally normal. This means your body is building protection for you. The most common side effects are listed and include symptoms like pain at the injection site, feeling tired, chills, and headache. These side effects shouldn't last longer than a few days. Keep in mind, any side effects that you may experience would not compare to symptoms you may experience if you're ever infected with COVID. So the benefit of this vaccine really outweighs the risks. Next slide. How do I know the COVID vaccine will continue to be monitored for safety? So there are ongoing monitoring and research systems in place to make sure the vaccine continues to be as safe as possible for as many people as possible. The CDC and the FDA have a few ways to track safety and efficacy, such as web surveys, side effect reporting symptoms, and claims-based data for surveillance and research. Next slide. So regarding the COVID vaccine, our duty to you is not to convince or coerce you into getting the COVID vaccine, but to engage with you and support you in any way that we can. We want our process to be multi-tiered, which will include first and foremost listening to you and your concerns and hearing your feedback. We want to provide correct and verifiable information about the COVID vaccine, take pause to acknowledge the history of racism and discrimination in medicine, offer support and feedback, and make ourselves available to you and your residents for any concerns. Next slide. Some of the other common questions or concerns about the vaccine. So the COVID-19 vaccine cannot infect you with the COVID-19 virus, change or alter your DNA, or cause you to test positive for the virus with a nasal swab. The FDA and CDC did not skip any safety steps to get the vaccine produced quicker. The vaccine does not contain a live virus or part of a live virus, and there is no microchip in the vaccine. Next slide. The vaccine is absolutely free of charge. No payment is required. The vaccine will cause you to test positive for the antibodies, but this is normal and expected part of the process. How long will it take for the vaccine to be fully effective? It's about 2 weeks after the second and final dose is given. Can I still get COVID after getting the vaccine? Yes, but the risk is reduced by 95% and severe disease is less likely. And also, you will still need to wear a mask and practice other infection control measures even after you're vaccinated. Next slide. So to summarize, the COVID-19 vaccine is a very important tool to help stop the pandemic and get us back to normal. Final slide. So for questions, concerns, comments, now is the time to speak your mind. Let us know if there's any other lingering questions, concerns, comments, or feedback. If it's an answer we don't know immediately, we can get back to you with an informed response. If it's a question that can't be answered right now, either due to a lack of data or additional research that's needed, we can talk openly about what information is available to discuss. And we can actually start with questions that have already been submitted for this Q&A session and also submitted in the chat.
So thank you so much for an amazing presentation. I really appreciate it. Sorry about that. Are you guys hearing it as well, or is it better?
It's better. It's not bad.
Okay. So is it legal to make the vaccine mandatory for work in schools? The short answer is yes. Places can make it mandatory. I think that it is not. The Chicago Department of Public Health, DFS says it's not mandatory to be in a shelter, and people don't want that to happen, and no healthcare provider is going to administer a vaccine to somebody who doesn't want it, at least not any of our staff. So that hopefully we won't get to that point here in Chicago. There have been reports of people who have had the vaccine with adverse reactions. So we have everywhere we go kits that we take with us. As much as important as it is to have the vaccine, when we go to a site to vaccinate, it is just as important to have that emergency kit. The CDC has set out some significant guidelines of what we need to have, and we do have those supplies, and they will be with us every time we go to administer vaccination. Overall, there have been millions of doses. I think 2 million doses in the U.S. At least 29 people who have had bad reactions that have been reported. So this is a very safe vaccine. probably the most important question today. Yes, there is general distrust within African American community surrounding vaccines due to people of color being historically used as test subjects for medication. Will this be provided to provide comfort within the community, especially within the shelters? Yes, this is our first step. Our second step is to learn. We need to learn from you and from your shelter staff and from your participants what their concerns are and what we can do to help with the process of vaccination and how we can listen, how we can be better providers and better listeners. We're going to be sending our behavioral health staff into shelters as we prepare to provide vaccination, to work with participants and staff to help us better understand some of the issues and to help us guide decisions and help and to educate us. We're the ones that need the education on this, the healthcare providers.
Mary, there was a question. There have been reports of people who have gotten the vaccine and had adverse side effects. How is this being addressed?
Oh, we have all our material on site. Everything that we need. We have EpiPens and Benadryl and oxygen if needed. Hopefully they will expire and never be used. But everything is available on site wherever we have a vaccine. Other questions?
Yeah, I'm trying to scan through the Q&A just to make sure everything has been addressed either by Mary or in the presentation. Is there anything that we're missing? Any other questions that you guys have that wasn't covered? Oh, Betsy just asked one, Mary. Is the 30 minutes of monitoring a part of getting the vaccine?
Yes. So after the so each site will be assessed individually as to how the flow is going to be when we do the vaccine. We will be needing to have people to sit and be monitored for 30 minutes after it's done. We're not leaving until the last person is monitored. A couple other things on vaccine rollout. As I said before, we don't have a date. When we do, we will let you know. Certainly the largest and more congregate places would be first, in places that don't have, or places that are where people are sleeping together. We also, oh, I can't even remember what else I was going to say right now. Question: Our staff prioritized for vaccination. Vaccination members of their household also be prioritized. So members of the household are not prioritized. Us in this, along with shelter staff, they may be prioritized because of their age or other health conditions. Staff are yesterday the governor said staff of homeless shelters are considered 1B, and we are hoping, although we don't know what it will look like, we're hoping to be able to vaccinate at the same time we vaccinate residents, or there will also be an option through points of distribution from the health department that shelter staff may be able to go there as well. As soon as we know exactly what that looks like, we'll let you know. Betsy, I wish I knew that the answer to your question, but we know we're advocating for staff and participants to both be vaccinated. Just don't know how. If the number of homeless individuals that have been relatively low for those that have contracted COVID, why are the shelters priority? Because congregate living, I think in Chicago we have a really wonderful Department of Family and Support Services and the Chicago Department of Public Health. They've been fabulous and really looked at the data and decompressed the shelter so that we could keep numbers as low. And you know, the response that we've had from our partners, our shelter partners, our healthcare partners, and our public health entities working together is really unprecedented. I also work with the National Healthcare for the Homeless Council. I think what we've done in Chicago has been pretty phenomenal, which is why some of the numbers are low. But it's still a high risk. Just because it hasn't happened yet doesn't mean it won't. So shelters still remain a priority, especially with a new strain in our country that is seems to be more easily spread.
This is a question, Mary, that we talked about in the prior presentation, but maybe would be good to raise again. So the question of, will Heartland nurses be able to provide guidance to an individual with allergies, pregnancy, or other health conditions about whether to get the vaccine or not on the day of the vaccine distribution?
Yes, everybody will have the opportunity to meet with a healthcare provider and discuss that. Absolutely. Will Heartland come to sites more than once to conduct vaccination since the clients change from night to night? Yes. Exactly how that will look, though, I can't tell you. Yet. We know that we'll more than likely use the Moderna vaccine. That we will be there, for first round, and then we will be there again in 4 weeks. We do expect to get many people who said no the first round to say to want a first vaccine when we're there for the second round, and that's fine. We will be planning for that. What the interim period of that will look like really depends on how many sites we need to vaccinate and what the vaccine distribution looks like. So in the long term, yes, there will be made a plan, and as soon as the plan is made, again, that's something else for the future that we will have to let you know as soon as we know. The American College of Obstetrics and Gynecology does recommend that pregnant women be vaccinated for COVID. That is a decision that we recommend that all pregnant women discuss with their prenatal care provider, but it is recommended.
And just to add, it's also based on just the ingredients that we know of that are there. There's nothing too, what's the word I'm looking for? That would contraindicate a pregnant person or a huge concern of a pregnant person getting the vaccine.
So the difference between Pfizer and Moderna, the ingredients, they're actually really structurally similar. There's some differences in their buffers and salts and fats, but they're very, very similar. The Pfizer storage is much more difficult because it has to be kept at negative 72 degrees for a much longer period of time. The Moderna vaccine is stable 30 days after it's been out of the freezer, but the Moderna vaccine vials are 10-dose vials, and they need to be used within 6 hours of opening the vial, which is why that when it is time to do vaccination, we're going to really try to make all of our efforts to be very early morning efforts. If we get done and we have 8 vaccines in a vial, I need to find another place where people are experiencing homelessness to administer that vaccine, because we are not going to waste any doses. So we do need to have some buffer time at the end of the day to make sure that happens. Most reactions, I think, also on reaction, I think Moderna had maybe more with the first shot, but they were pretty equal at the second. Is that correct, Sam, if I remember?
Yeah. So yeah, that's the thought for Moderna, is that there's not too much of a difference between first and second. With Pfizer, it seems to be not feeling much on the first dose, but the second dose having some side effects. So that's how they differ a little bit too.
The second dose, yeah, for both of them is probably more side effects.
Any other questions that we've missed, or any that come up?
So our next steps will be to contact you within the next few weeks to start having our staff out to engage your staff and your participants in conversations around vaccination for us to learn. If you have any information or anything that you think would be helpful for us to know as we get ready, we really appreciate it. We want your input. We want staff input. We want participant input. This is all of us together. And we want to make sure that everybody is comfortable with the information to make the best decision they can for their health. It may be how long it's effective, longer than what they initially thought. They don't exactly know, but it could be years. The vaccine effectiveness could be years.
And also Jade put into the chat, for any questions after the presentation, after this is finished, you can contact us at sheltercare@heartlandalliance.org. So send any questions or anything to that email address, and we can get that taken care of.
Well, if there aren't any other questions, and we really appreciate your time, and we certainly appreciate you working with us so that we can bring advocacy and so that we can learn from you. We will make the slides available and answer any and all questions that you're having.
Yes, thank you, everyone.
Thank you.
We'll be in contact. Thanks, guys.